my name is Cindy. I'm a registered nurse and I'm going to talk today about hydration and how it affects your skin. The first thing about hydration is that in order for metabolic processes to work correctly within the body, there must be a fluid balance. Fluid balance describes the balance of the input of fluids into the body and the output of fluids. Dehydration is a term that's used when a person has less water than they need for their body to function properly. Physical symptoms of dehydration include decreased cognitive function, headache, complaint of thirst, fatigue, weight loss, decreased urine output, and a more concentrated urine output. Their skin is dry and less elastic, and their mucous membranes will be dry. If dehydration is left untreated, it could lead to other complications such as hypotension, tachycardia, feet and hands will be cold, and it could also lead to hypovolemic shock due to a decrease in circulating blood volume. There's a couple of ways to test for dehydration. The first one is called capillary refill time. That is used to measure the amount of perfusion to the areas of the extremities. This can be measured by holding your hand up at your heart level and pressing your fingernail bed down until it turns white or blanched. Once that happens, then you let go and you time how long it takes your finger to turn back to the color that it was, that pinkish color under the nail bed. Normally this is about 2 seconds. Longer times means that there isn't as much perfusion going on in the extremities, so there is kind of a sign that there could be some dehydration going on. Capillary refill time should not be used alone to measure hydration status, though, as there are other factors that can alter those findings. Those factors include age of the patient, temperature of the environment, nutrition status of the patient, malnutrition being one of them, and other disease processes which can affect fluid and electrolyte balance. Another test that you can use is a test called a skin turgor test. Skin turgor is the elasticity of the skin, which means that skin can take on a different shape and then go back to its normal shape. Measuring skin turgor is a way to check to see if the elasticity is still there. Normally it's measured on the back of the hand, the lower arm, or on the abdomen. What you do to measure skin turgor is you grab some skin between your fingers and hold it up into a tent-like shape, and then you let go of it and you time how long it takes the skin to go back into its original form. People who are dehydrated, it will take longer for their skin to go back to its original form. They're back to the original shape that it started. Skin that has normal turgor will return more quickly than skin that is dehydrated. So in essence, the longer time that it takes the skin to return to normal, the more advanced dehydration is. Normally, decreased skin turgor is an advanced sign of dehydration, and that would be during moderate to severe dehydration, which is about 10 to 15% fluid loss of body weight is actually lost. Other diseases can affect skin turgor, such as scleroderma and Ehlers-Danlos syndrome. These two are not related to dehydration and normally will be diagnosed prior to any dehydration testing that needs to be done. Poor skin turgor is serious and it should be reported right away. Normally they will do a fluid replacement therapy. Fluid replacement therapy should be done slowly, as if it's done too rapidly, then brain cells will absorb the water too rapidly and it could cause cerebral edema, seizures, or other brain injuries, including death. There are some causes of dehydration that include severe vomiting and diarrhea related to gastrointestinal problems that people have. They also could be related to medication side effects or profuse sweating when it's hot and you're physically active. So it's important to keep yourself hydrated while you're physically active and it's too warm outside. The other part of being dehydrated is that it causes a low blood circulating volume, so your heart will beat faster to try to make up the difference and get enough blood to the extremities and to the organs that need it. So it's important that you keep yourself hydrated at all times. Thank you for your time.